Welcome everyone to our 28th COVID Town Hall。大家好，歡迎大家參加我哋今日嘅新冠肺炎病疫第28個嘅視像論壇。時間過得真係快啊！已經做咗28集，咁我哋每個月做一集，即係已經過咗28個月。So I'm Diana Lau, and I'm the director of the Asian Health Institute at UCSF。我係劉淑燕，我係加大亞裔健康研究院嘅主任。And with us today are two wonderful experts from the UCSF Health, and one is Dr. Katherine Yang, and the other one is Dr. Peter Chin Hong. You've seen him here in Town Hall multiple times, and you've seen him on television almost every other day or every day, depending on what channel you watch. So, and Dr. Yang actually has appeared in our Town Hall also before, but she's not as appearing as often as Dr. Peter Chin Hong. So anyways, let me just briefly let you know that Dr. Yang is our clinical professor at the UCSF School of Pharmacy. She was just reminding me that she went to our School of Pharmacy here. And of course, our pharmacy school is a top school in the nation. And so she has to be very good to even get in there. And so, but fortunately, even though she went away to UC Berkeley to get her master's degree in public health, she came back and worked here at UCSF, and we didn't lose her. So it's great to keep these smart clinicians and scientists around at UCSF. And Dr. Peter Chin Hong is our professor in the Infectious Disease Division, and he's also the Associate Dean for our regional UC campuses. And I think that he's also going to be the poster child for our communications department. So we thank you very much, Dr. Chin Hong, for your compassion and for your extra outreach that is above and beyond what you do as a physician, which should have kept you very busy during all this time. I mean, we have COVID, and then now we have monkeypox, right? It's one thing after another, and the flu's coming back. You just reminded me. Yeah, after the summer, then there's the fall, and in the fall and the winter, the flu season is returning. So Dr. Yang 咧就係我哋嘅即係 UCSF 咧，除咗有醫學院之外咧，仲有啲護士學院啊，有啲藥劑師學院啊咁嘅。咁佢係喺我哋嘅藥劑師學院嗰度畢業嘅。咁畢業完之後咧，就去咗Berkeley 即係對面嗰間大學啦，就攞咗個碩士，係呢個公共衛生嘅碩士。咁然後咧，好在佢又翻嚟UCSF 嗰度做翻教授。咁咧陳子平教授咧，你哋大家都應該係見過同埋係好相熟噶啦，因為佢除咗喺我哋呢啲講座裏邊出現過無數次之外咧，佢亦都喺呢個電視啦，中文嘅電視、英文嘅電視啦，佢都出現嘅，同埋啲報紙又訪問佢啦，嗰啲收音機又訪問佢啦。咁總之佢個名咧就成日即係而家係非常之見得好多嘅。咁我哋好多謝佢陳子平教授喺百忙之中，同埋楊教授喺百忙之中咧，係抽時間嚟同我哋做今日嘅講座嘅。咁當然我亦都係多謝大家嚟到參加啦。So 今日咧就主要嚟講咧，就係我哋想睇下將來我哋將來嘅世界會係點啊？將來嘅世界呢個好顯明就係呢個新冠肺炎會係同我哋一齊繼續一齊前進㗎啦。咁到底我哋要而家係知道咗啲咩嘢？由而家知道嘅知識點樣向前去推進，去等我哋以後嘅生活可以雖然有呢個新冠肺炎，但係都可以過得比以前好啲啦。咁咧就呢個就係今日最主要講嘅嘢啦。咁咧就由呢兩位教授咧逐點同你講嘅。So this is the agenda for today. We do as before. There's a little introduction, and then Dr. Yang's going to go into talking about the vaccines and the drugs and the treatments, and then Dr. Peter Chin Hong is going to give us the overall picture of how are we going to face this COVID moving forward for in our future world, and what are the things that we can do to make our lives easier so that we can live with it, and what things we expect to change using his expertise in the area for what he already know at this time. 咁跟住咧就有啲問答時間啦。Then we have questions and answers and some closing remarks. So I'm going to turn it over to you, Dr. Yang. 咁我而家將個平台交俾Dr. Yang，等佢去同我哋講呢個新冠肺炎同埋治療方法嘅進展。
So we're going to talk about vaccination for children 6 months to 4 to 5 years old. So this is new stuff. This just basically came out within the last week or so. And actually Tuesday was the first day that you could get vaccine.
咁咧就係楊教授啦嚇，咁佢咧就係會同我哋講呢個疫苗嗰啲咁嘅嘢啦。咁咧首先咧就係講細路仔接種疫苗，就係呢個6個月至到4、5歲大嘅細路仔咧，而家係啱啱由呢個藥物食物管理局咧係批准咗，同埋呢個疾控中心係批准咗佢哋係可以打疫苗嘅。呢個批准嘅過程咧就係上個禮拜嘅時候發生嘅。咁就星期2嘅時候咧就開始啲細路仔可以打疫苗，就係今日星期4，即係2日之前咧啲細路仔可以開始打疫苗嘅。咁咧就我正話唔記得提一提大家咧，就係喺呢個視像平台嗰度咧就有個 Q&A box 嘅。如果你哋睇見有啲咩問題嘅時候咧，你想問呢啲醫生嘅，你係可以將你啲問題擺入個 Q&A box 嗰度，用中文英文寫都得嘅。咁我哋陣間就會盡量答啦嚇。
These are the 2 different vaccines that are available for small children. And these are the ones that we've had for the longest, Pfizer and Moderna. They are a little bit different. So you can see that for Pfizer, it's for 6 months to 4-year-olds. And for Moderna, it's 6 months to 5-year-olds. So this is just because they studied the drugs differently. You can see that the doses are very small compared to adult doses. So for Pfizer, it's 1/10 of the dose. And for Moderna, it's 1/4 of the dose. Another main difference is that the Pfizer vaccine is actually for the primary series, the main shots, it's 3. But for Moderna, it's only 2 shots. So when we look at the side effects, though, anytime we vaccinate small children, we always have very, very similar side effects, in my opinion. So you get kids who end up being extra fussy, they may not nurse as well, they get a little bit of a fever, or they can get sleepy. So they're a little bit more, they'll sleep more during the few days after their vaccine. For both of these vaccines, we did see more side effects than if they got placebo. And in general, the Moderna had slightly more. So Moderna had a little bit more fever and a little bit more fussiness compared to the Pfizer vaccine.
咁呢個細路仔即係幼童啦嚇，就係因為佢係6個月至到4、5歲啊嘛。咁咧就係只係有2種嘅疫苗可以打嘅啫，喺美國嚟講，一個咧就係輝瑞啦，一個咧就係莫德納。咁咧輝瑞嗰個咧就可以打到4歲大嘅細蚊仔嘅，咁莫德納嗰個咧就係可以打到5歲嘅。咁即係話，如果你個細路仔係4歲至5歲之間咧，就只有一個選擇，就係打莫德納。咁咧2種藥啦，就係有少少唔同嘅。咁咧就大人嘅劑量咧喺輝瑞嗰度咧就係30個microgram 一劑啊。咁咧喺Moderna 嗰個莫德納嗰度咧就係100個 microgram， 所以咧就算係大人嘅劑量咧，都係呢個莫德納嗰度嗰個劑量咧係高出咗70個 microgram 嘅。咁咧所以咧佢因為個嘅劑量高咗咧，嗰個副作用咧亦都係比較高啲嘅。喂，你啲即係個身體裏邊多啲藥啦嘛。咁咧就打法啦。咁咧呢個輝瑞嗰個咧就係只係成人嗰個藥量嘅1/10俾啲細路仔嘅啫，1/10，咁佢只係30個 microgram 大人嘅 dose， 咁佢1/10咪變咗得3個 microgram 咯，所以每打一次只係攞3個 microgram， 所以係好細嘅，所以佢一定要打3次嘅。咁咧頭嗰2次咧就係相隔3個星期，咁跟住咧第3次嗰個咧就要最少隔 8個星期先至打第3次嘅。咁呢個莫德納呢個咧，因為佢個劑量大啲咧，佢就打2劑就夠噶啦。咁打2劑咧，相隔咧第一、第2劑咧就係4個星期嘅。咁至於副作用方面，我哋正話已經講過，就係話輝瑞嗰個因為個劑量係細啲，所以佢嘅副作用咧都會細，跟住少啲嘅。但係咧至於係乜嘢副作用咧，咁兩個藥咧都係非常之相似嘅，只係一個多啲，一個少啲。咁劑量大啲，個莫德納就多啲咯，係咪多啲人有咯？咁咧就係細路仔扭計啦，成日好似烏眉瞌睡咁瞓啦，咁同埋咧喺個手臂嗰度打針個位咧會痛嘅。咁但係呢啲咁嘅副作用咧，好快就會過嘅，1-2日嚟過噶啦。咁如果佢係飲多啲水啊咁樣咧，就亦都係會減輕啲副作用。Dr. Yang, talking about fluid intake during this time. So if the kids take in more fluids, would the side effects be less?
I don't necessarily know if they'd be less, but it never hurts to take more fluids because that will help with the fever and it will make them feel better.
Okay, that's great. I know some parents went to the extreme of like pumping fluid in kids, like making drink like 36 ounces of fluids. Is that too much?
It depends on how big the kid is. 36 ounces of fluid in a 6-month-old sounds like a lot. So it depends on the child. I wouldn't force water on them, but definitely more fluids will help with the fever. A little bit more information on the difference between the 2 vaccines and who should get it and when. So if you have a 4-year-old child, remember you can only get the Pfizer. But if you are 4 or 5-year-old, you can get Moderna. So there's a difference. So one of the things that parents wonder is if my child is 4 years old, should I wait to get Moderna or whatever? It doesn't really matter. So, but just remember that if you're between 4 and 5 years old, you can only get Pfizer. And here you can see on the slide how well the 2 vaccines work against infection. I think sometimes this is a little bit misleading because if you just look at the numbers, it really looks like Pfizer is much, much better than Moderna. But the vaccines aren't always one-to-one comparable that way. And remember, Pfizer is 3 doses and Moderna is 2 doses. So in a 6-month-old to 2-year-old, the Pfizer vaccine works about 76% of the time in terms of vaccine effectiveness. And for Moderna, it's about 51%. And interestingly, that's flipped when you get to the older kids. So in the older kids, the Pfizer works better, and in Moderna, it works a little bit less. So it doesn't necessarily mean one is better than the other. Remember, they're different vaccines and the doses are different. Pfizer is 3 shots because it was a very low dose. So it's 3 shots of low dose versus Moderna is only 2. So when should the small child get the vaccination? Whenever they are eligible. So as soon as they're eligible to get vaccine, they should start. They can get vaccine with other vaccine if they want to. I try not to do that if I can avoid it, because sometimes when they get fussy, you don't know which one they get fussy from, but you can if you don't have time to go to the doctor too many times. And if they've had COVID-19 in the past, they can get vaccinated as soon as they're over their COVID and out of isolation. So you don't necessarily need to wait. You can if you want to. You can wait as much as 3 months, but you don't have to. You can get it as soon as you're out of isolation.
咁咧就我其實正話係問咗楊教授一個問題嘅，就係話有啲醫生咧好多時話你啲細路仔去打疫苗嘅時候咧就俾多啲水去飲啦。咁我話有啲家長咧俾成3-4杯水俾個細路仔去谷佢飲嘅咁佢楊教授話總之即係亦都唔需要谷得太犀利嘅，總之係俾多啲水啦。因為好多時個細路仔打完針之後咧係有少少發燒嘅，咁有少少發燒咧飲多啲水咧係等呢啲副作用咧係冇咁即係個發燒冇咁高咯。咁呢個有效性啦，講呢2隻藥嘅有效性啊。如果你就咁睇咧，就覺得係呢個輝瑞呢隻藥咧係有用啲嘅。如果係佢可打輝瑞，因為佢係打3針啦。咁你睇下佢嗰個有效嘅率咧，就係 6個月至2年就係76% 有效。2歲至4歲咧就係到82% 有效。總括嚟講咧，平均6個月至到4歲嘅細蚊仔咧係有80%嘅細路仔咧係有效。咁有效係咩意思咧？有效咧就係話有效去防止呢個唔係防止啊，係減低呢個有症狀嘅感染。咁咧就係喺莫丹娜嚟講咧，咁你當然如果個細蚊仔係啱啱4歲幾嘅，4歲幾你過咗4歲你就唔可以打輝瑞啦，咁咧就要打莫德納啦。咁莫德納咧就係6個月至2年又好，2歲至5歲又好咧，都係個有效率咧係比呢個輝瑞咧係低嘅。咁平均嚟講咧就係得41% 有效去防止呢個有症狀嘅感染嘅。咁咧細路仔咧應該係幾時打呢啲疫苗咧？咁而家疫苗出咗啦，如果佢係6個月大以上嘅就可以打噶啦，就唔需要等噶啦。但係譬如你話即係而家我哋知道，因為呢個疾控中心咧啱啱先出咗個報告，就係話大概有成七成半啊，即係4個細蚊仔之中有成3個咧係已經曾經受咗感染噶啦。咁如果係咁嘅情形咧，如果你啱啱個細路仔啱啱唔好彩受咗感染咧，咁你咪等佢感染完好翻啦，嗰陣時就可以打啦，就唔需要話要等3個月啊、5個月啊咁嘅，即係你想等都得，不過就冇咁嘅必要嘅，係可以即刻可以打嘅。
Okay, so moving on to what do I need to know about the Moderna and Pfizer COVID vaccine boosters? So in general, I think there are 3 main questions. Should I get the vaccine booster? Does it work? And which one should I get? So should I get it? The answer is always going to be yes. So the third dose or the first booster is always the most important. So you're going to get the most effect from the first booster. People who are 50 years and older and definitely immune compromised can qualify then for the second booster. So then the question is, should I get the second booster? And the answer is, if you are immune compromised and you're older, the answer again is yes. So, and does it work? We know that the main effect from the booster is from the third booster, definitely. And we do get some effect from the first booster or the third dose. And the second booster also gives you some protection as well. Unfortunately, the effect of the booster goes down with time. And after about, it's pretty short-lived, especially with the second booster. Probably, I think the data is now that it's the immunity goes down after a couple months. But the thing to remember is you can get boosted and you can still get infected, but you will likely not have a severe case. So that's the important thing, right? So everybody's thinking about boosters in terms of whether or not I get COVID. But you have to also think about, once I get COVID, will I get really sick? And the boosters are really good at preventing you from getting really sick. Which one should I get? Right now, there are only 2 options, Moderna and Pfizer, right? It's better to get one or the other. It doesn't really matter which one you get. You can mix and match if you want. You should not get J&J if you can avoid it. And we have these new boosters coming out in the fall that will be bivalent. So they will be active against Omicron. So that will be very exciting to see. I would not wait. If you qualify for booster now, just get it now. And then we'll see what happens when we get to the fall.
咁咧就係呢個係講嗰個加強劑啦。咁到底我哋要知道啲咩嘢咧？需唔需要打呢個加強劑咧？咁咧就係要睇你個人啦，係咪啊？即係自己係咩年紀啊，有咩病啊咁樣。但係咧第一個加強劑咧，其實因為個個都係應該要打第一個加強劑嘅，咁啲人咧而家咧都已經話，咁其實都唔應該叫加強劑，你應該係一個 叫做話應該係個個都要打3針，唔係打2針係咪？唔好話打2針又要打一個加強劑，然後跟住打第2個加強劑。其實簡單嚟講就係每個大人都係打3針咁就係啦。OK， 咁然後咧再即係我哋嘅所謂第2個加強劑咧，就係要睇下嗰個人有冇病啊，嗰個免疫系統有冇問題啊。如果個免疫系統係有問題嘅，係弱嘅，或者係可能係做緊化療啊、電療啊嗰啲咁，係即係整到個身體弱嘅咧，或者有其他嘅疾病係令到個免疫系統係弱嘅咧，咁呢啲人士或者係65歲、50歲以上嘅人士咧，都可以打加強劑嘅啦。以前就係60歲以上，而家就係50歲以上都可以打加強劑嘅啦。咁但係咧，我哋知道咧，因為而家嗰個病毒啊，嗰個變種病毒咧，第2代嘅變種病毒咧，已經係對叫做可以隱蔽嘅佢自己。你打咗呢啲疫苗又好，或者以前有個中過呢個標係話有個呢個新冠肺炎又好，個身體裏邊有個免疫系統。Okay? 但係咧而家新呢個病毒咧，佢係可以隱蔽，係個免疫系統係睇唔到佢嘅，係佢係即係對佢係冇作用啊！即係你打咗呢啲針同埋冇打，同埋呢個以前有個感染咧，對受感染方面咧係冇作用嘅。但係咧都係要打，點解咧？因為咧係受感染冇作用啫，但係咧佢咧係個身體裏邊有個免疫能力咧，係會增強咗，係可以對抗呢啲疫苗咧，對抗呢啲病毒咧，係等個身體咧係唔會有大病。所以而家嚟講咧，打呢啲咁嘅加強劑咧，就唔係為咗去防止感染，係為咗感染咗之後，假如間感染咗之後係唔會大病，係唔使入醫院，甚至唔使死亡，係喺依方面嚟到要打呢個加強劑。咁咧而家打加強劑咧就得2種藥咧，一個就係輝瑞，一個就係莫德納啦，係咪？咁咧就呢個 J&J Johnson & Johnson 呢個藥咧，我哋就唔建議你去打啦。咁咧遲啲咧就仲有一隻新藥出嘅，咁啊遲啲先講啦。咁就到秋天嘅時候咧，大概到秋天嘅時候咧，就可能有一隻藥出嚟咧，就係針對即係呢個輝瑞同埋莫德納同埋新嗰隻藥咧，都會出一隻新嘅藥出嚟咧，係會針對而家嗰個新嘅變種嘅疫苗嘅變種嘅病毒嘅，就係呢個 BA4、BA5、BA2.1、2.1嗰啲咁嘅病毒株。咁所以到時咧就會應該嘅情況好啲。但係我哋如果係可以夠資格打呢啲咁嘅加強劑嘅時候咧，就唔好等啦，就而家打咗先。到時嘅時候如果出咗又已經過咗幾個月，就可能已經即係都要翻打噶啦。Okay.
And just 1 minute on the new vaccine. This one is not yet FDA authorized in the US. It is authorized in other countries for both adults and now in adolescents as of today. It's basically, from our perspective in the US, just a nice new addition to all the other tools we have in the toolkit. It's not meant to replace any of the other vaccines. It's just another option. And this vaccine is made with more traditional technology. So for people who are nervous about getting an mRNA vaccine, this might be a good option. Most of the studies, actually all the studies were done initially with non-Omicron, but there's no reason to expect that it would not work. It may work a little less, just like the other vaccines have worked a little bit less against Omicron, but it's just a nice addition to our toolkit.
呢個咧就係喺美國嘅第4隻疫苗啦。咁第一個就係輝瑞啦，第二個就係莫德納啦，第三個就係 Johnson & Johnson。咁呢個咧就係 Novavax 咧，就係 Novavax 係第4隻。OK， 咁呢第4隻疫苗咧就係用一種唔同嘅方法做嘅，唔係用呢個 mRNA 呢個咁嘅技術去做嘅。所以有啲人咧對呢個 mRNA 因為話佢係嗰啲咁嘅同基因有關咁樣咧，就唔肯打啦。咁或者喺呢啲人士嚟講咧，或者佢可以做呢個疫苗出嚟嘅時候，係可以打呢個新嘅疫苗啦。呢個係用普通即係製造疫苗嘅方法去做嘅。而家咧就未批准嘅，但係應該到秋天嘅時候應該批准㗎啦。
So we're going to talk a few minutes about treatment. So the most important drug for treatment out there right now is Paxlovid. This is the generic name is nirmatrelvir ritonavir. And here I have listed who are people who should get it. And this is right out of the FDA label. So it's really for people who are 12 years and older, so it's not for little kids. They must have a positive COVID test, and it can be an antigen test or it can be a PCR. It doesn't matter. It can be a home test. Treatment has to be within 5 days of symptoms. That is the most important thing. And the people who will mostly benefit from this drug are patients who have at least one risk factor for having severe disease if they were to get COVID. And this includes older patients or people who have some other underlying health condition, such as diabetes, Alzheimer's disease, some kind of disability, some kind of lung infection, and other issues like health inequities. So living in a house with a lot of people, not having great access to healthcare, et cetera. So this is a great option. This is something that is really important for people who are at risk for infection. And the main thing to remember, of course, is you have to take it within 5 days.
咁呢隻藥我哋而家講轉態啦，唔係講疫苗啦，係講另外一隻藥啦。呢隻藥咧叫做 Paxlovid， 我都唔知道佢中文係譯做咩嘢啦嚇，呢啲新藥嘅名。咁咧呢隻 Paxlovid 咧係口服嘅一個抗病毒劑嚟嘅。咁咧呢隻藥咧就真係係改變呢個世界嘅一個非常之重要嘅藥嚟嘅。因為以前咧我哋如果係有感染對呢個病毒咧，即係都相當係束手無策嘅。啲醫生係試下呢隻藥，試下嗰隻藥咁樣，但係而家呢隻 Paxlovid 咧就真正咧就係講就係話出嚟嘅時候咧就係話我呢隻藥咧就係要嚟俾患咗新冠肺炎呢啲人士食嘅。咁咧呢隻藥咧係會減低佢哋嘅死亡率，同埋減低佢哋入醫院嘅機率嘅。咁咧特別咧就係對嗰啲高危嘅人士啊係有作用嘅。但係其中一個最重要嘅嘢咧，就係要喺出咗症狀之後嘅5日之內，你就要開始服食啦。咁5日好似好長咁樣，但係你知道啦，其實啲時間過得好快嘅，因為咧初你有咗之後，你可能又唔知道係呢個係新冠肺炎喎，因為你初嘅症狀好輕㗎嘛，係咪？咁你咧就可能冇去查啦。但係如果你屋企嗰度有嗰啲快速測試盒啊，你去自己譬如有少少傷風啊，或者有少少好似輕輕地啊咁樣，去或者覺得佢好攰啊咁，就用嗰個測試盒去檢查下咧，咁你就可能咧就會查到自己係已經係中咗標嘅。咁但係假如間你今日查你係陰性嘅，咁你係咪覺得係真係就係陰性就係冇事咧？咁就唔係嘅。你其實因為如果你個病毒量低得滯嘅時候咧，你用嗰啲快速盒去查咧，佢係睇唔到嘅，因為佢唔係嗰個 PCR test 咧，佢係唔會將你嗰啲病毒量擴大，所以咧個病毒量太過細嘅時候咧，佢就查唔到嘅時候咧，你就以為係陰性，所以你咪好容易咪過咗1、2日咯，係咪啊？咁咧跟住咧，如果你醒目嘅咧，你話咦唔係喎，我過咗1、2日，我啲病徵啊都好似仲喺度喎，又有少少傷風啊，或者頭痛啊，諸如此類，或者周身骨痛啊，肌肉痛咁樣，即係總之個人覺得唔妥啦。你精嘅咧，你就再去檢查一次。咁過咗2日之後咧，個病毒量咧喺你個身體嗰度咧就可能多咗啦。咁啊前嗰2日驗唔到嘅時候，而家可以驗到啦。咁你而家驗到咧，但係你嘅症狀已經出咗2、3日啦喎，啱唔啱啊？咁你而家驗到，你就要即刻去知道話哦，弊啦，陽性。咁點咧？你就要打電話俾醫生。你打電話俾醫生嘅時候咧，咁你就要揾到個醫生啦喎。嗱，如果你唔好彩，啱呢個時候係星期六、星期日或者係啱3日嘅假期 ，OK？ 或者係夜晚黑咁，你揾唔到醫生噶嘛？即刻佢又會打翻電話俾你。咁啊點知佢幾時打咧？可能希望1日之內可以打到俾你啦，係咪？咁佢打俾你嘅時候，咁啊已經又第3、第4日啦。咁啊佢話俾你聽，咁你可以食呢隻藥啦咁。咁到時你係咪要去揾藥啊？咁你去揾藥，你要知道去邊個藥房啦喎。如果初嘅時候唔知，咩都唔知嘅，到時先諗聲話，哎呀要去揾呢隻藥啊，去邊度有得賣啊咁樣，你就變咗好似倒瀉籮蟹咁啊。所以5日咧嘅時間係非常之容易過嘅，所以咧大家係要有啲準備，因為呢個藥咧過咗5日之後咧就即係冇咩作用啊。 咁咧，但係如果係第3、第4日食咧，個作用係非常之好嘅，係可以防止重症。咁呢啲咩人咧？就係過咗65歲以上嘅人啦。咁咧，同埋咧係有咩，即係嗰啲病啦，血壓高啊、糖尿病啊、心臟病啊、腎病啊，諸如此類，總之係大劑嗰啲病啦，係嘛？咁或者咧，你係住喺一啲好逼嘅地方啊，話一家人住埋一間房啊，嗰啲唐埠嗰啲咁嘅房咧，係嘛？咁你如果係喺呢啲咁嘅環境嗰度咧，你知道你自己係高危啦。如果唔係你身體嘅高危咧，就係你住宿嘅狀況係高危。OK， 咁樣兩樣嘢就即係呢隻藥咧係可以防止你病得咁犀利咯。
So I think one of the things we don't talk about that often is who should not get Paxlovid. And this is very important because Paxlovid does have a lot of drug-drug interactions. So we'll talk about that on the next slide of what to do. But if you have a contraindicated drug-drug interaction, you cannot take Paxlovid. It's also not authorized for prophylaxis. And it's not a drug that we can keep at home just in case we get infection. That's not okay to do. So it's really for prescribing after a patient gets infected, not to have around just in case. A lot of patients want to have this drug around with them in case they travel. So they think, oh, I'm going to go out of the country or I'm going to go to another state. So I want to just pack some in my suitcase in case I get sick. And that's not really the way this drug was meant to be used. There's been a lot of discussion about whether or not Paxlovid should be given for more than 5 days. And that study is right now taking place. So we don't have the answer to that yet. Right now, we can only give it for 5 days. So we shouldn't be extending it until we have more data. And we have heard a lot about COVID rebound. This is not Paxlovid rebound because even people who have COVID and don't take Paxlovid can get a rebound of either virus or symptoms. And at the moment, the recommendation is not to retreat in patients who have rebound symptoms. And I just show here a recent paper that showed that it does work in a real life population. So remember that the original studies were done in patients who were not vaccinated. And now looking at real world data in a mix of patients who were vaccinated and unvaccinated, and during Omicron BA 2.2, it still looks like it works, which is good.
咁咧呢隻藥咧，我哋好多時就話邊啲人需要食咧，咁我哋即係需要食嗰啲人，我哋正話已經講咗啦。但係咧好多時咧就係冇話，咁邊啲人唔食得㗎，或者係邊啲人係唔應該食㗎咁。咁咧而家咧就依張slide 咧就係話俾你聽，邊啲人唔應該食咧，就係呢隻藥咧，佢好就好啦，但係佢咧個問題咧就係同好多其他嘅藥啊，係會大家會有交叉嘅效應嘅。咁變咗咧，即係大家嘅藥啊同藥之間咧，就會產生個作用咧，就係可能將另外一隻藥嘅藥性增加啊，或者減少啊咁樣。所以咧，有啲藥啊，有啲病人用開佢，即係大家都知道，有啲老人家咧，一日可以食8、9隻藥噶嘛。咁如果嗰啲藥之中啊，有啲藥咧係同呢隻藥。呢隻 Paxlovid 呢隻藥係有交叉感應嘅時候咧，咁咧你食咗佢咧，咁就相當危險下咯。咁係咪完全唔食得咧？又唔係。不過咧，個醫生咧就應該知道邊隻藥同邊隻藥之間係有問題嘅，佢就可能叫你停食呢兩隻呢隻即係有交叉感應嘅藥啦嚇，可能停食幾日。等你可以食咗呢隻藥先啦，然後嗰隻藥先食翻咁咯，即係可能要咁樣做。咁所以咧，你都係呢隻藥咧，一定係要醫生開俾你。咁個醫生咧開俾你嘅時候咧，你一定要同佢問清楚佢話我而家食緊呢隻藥嘅喎，有冇問題啊咁樣。因為有時醫生忙得滯咧，都可能有啲錯漏嘅，咁啊減低你個即係大家嘅對話清楚啲咧，就會減低呢個錯嘅情況啦。咁呢隻藥咧，並唔係要嚟預防嘅，同預防完全冇關嘅。呢隻藥係要嚟醫你嘅，係要嚟你有咗呢個新冠肺炎之後要嚟醫新冠肺炎嘅。所以咧，你未有之前咧， 請你唔好食，唔係話食咗咧就冇，食咗佢唔可以同你預防肺炎嘅 ，OK？ 咁咧，所以咧就唔可以話哇咁都唔係啦。如果係醫食藥咁好嘢，我食住佢先啦，食住佢先。咁啊，如果感染咗咧，都可以話我已經有醫食藥喺個身體嗰度啦，咁啊唔會病得咁緊要啦。咁但係唔係即係醫食藥唔係咁樣用法嘅，所以請你千祈唔好用，因為我哋好多時尤其是啲老人家咧，佢係會將啲藥咧要嚟話守門口啊。有啲藥係買嚟喺屋企守門口嘅，咁你都知啊，你好多可能屋企有啲中藥咧係要嚟守門口噶嘛，即係冇事嘅時候就擺住喺度，有事嘅時候即刻可以攞嚟食。咁啊，其實個意思係好嘅，但係就唔同呢隻藥就唔啱噶啦。咁有啲人講旅行咧，而家就嚟夏天啦，個個都想去旅行啦，咁啊話哇唔係喎，我離開咗美國之後，呢隻藥可能真係唔容易攞到喎。咁啊，呢個都係一個好嘅諗法嚟嘅，但係我哋就唔可以為咗你要去旅行就開定呢隻藥俾你先，等你帶住喺個身嗰度。咁如果一有事嘅時候即刻可以食，咁佢係啲醫生做唔到咯，因為呢個疾控中心係唔俾佢哋咁樣做啊嘛。咁而且咧最重要咧就係，如果你嗰個病徵已經過咗5日咧，咁你就唔應該食呢隻藥噶啦，因為你食咗都冇用啊。咁啊增加啲副作用。咁有啲人咧。就係話呢隻食咗呢隻藥之後咧，哇！食完之後食緊嗰陣時咧，就好似啲症狀減輕咗咁啊。但係停咗食完5日之後，佢又好似又翻轉頭喎，嗰啲症狀又嚟翻喎，又好似以前咁樣樣喎。咁好唔好食耐啲啊？咁樣樣咁啊！而家咧暫時嚟講咧，呢個研究喺度做緊嘅。係咪應該食耐啲？喺某啲情況之下可以食耐啲，但係因為佢仲係做緊研究，未批准咁樣做，所以而家咧暫時咧係唔可以食耐啲。個醫生只可以俾一個5日嘅劑量你食完就停啦。咁如果症狀翻發嘅時候咧，就係咪因為呢個藥翻發，或者係你總之你嗰個新冠肺炎係翻發啦，係嘛？嗰個症狀係唔走啦。咁如果係咁嘅時候咧，佢都唔可以再俾多個5日嘅藥量你啦。以後就唔知道。要睇下個研究報告先知。咁我哋而家知道咧，即係以前做呢個藥嘅研究嘅時候咧，就係多數咧係俾嗰啲冇打過針嗰啲人啊，因為冇打過針就係高危，就係佢話呢個新冠肺炎嘅機率係高好多噶嘛。咁咧就係俾冇打過呢個疫苗針嗰啲人去用嘅。咁但係而家咧就已經係打過針啊冇打針嘅人咧都一齊咁樣去用呢隻藥咧，都發覺咧都係有效嘅。都係可以將呢個住醫院嘅嘅危機係減低3成咁上下，而減低死亡率咧係減低到7-8成嘅7成半嘅。咁所以呢個藥係一個非常之有用嘅藥，係等到我哋可以生存得冇咁驚慌啊！因為而家好多人都感染咗噶嘛，但係因為有呢個藥，所以就係好多人都唔需要入醫院。呢個係一個非常非常之重要嘅藥嚟嘅。
So this is just a little bit of information of where I can get it. I don't need to read the slide for you, but just know that most of the community and retail pharmacies in San Francisco now all have Paxlovid. This used to be a drug that was hard to find, but now actually most retail pharmacies have it and there's no supply issue. You can see there's lots of options for you in terms of how to get it. So you can have it delivered to your home, or you can have it FedExed or Ubered. And the main thing to remember is if you do pick it up from the store, it's best to send either a friend or a family member that does not have COVID to the pharmacy to pick up your medication so you don't accidentally infect anybody.
That is so important. So 呢隻藥咧由初初冇到有，但係好難揾到而家係有喺美國，亦都係非常之容易得到，係一個轉變得非常之快嘅過程嚟嘅。咁我哋都可以話我哋係好幸運啦嚇，住喺美國嗰度就係容易得到呢隻藥啦。我相信喺其他嘅國家咧個難度可能會高啲咯。咁咧就係喺邊度攞咧？我哋就唔細講啦，就普通嘅藥房咧 ，CVS 啊、Walgreen 啊、Safeway 嗰啲都有噶啦。OK， 咁咧就係主要提一提大家嘅咧，就係如果你係感染咗 咁你即係有病毒啦，即係可以傳染俾人啦。你真係要係應該居家隔離咯，唔好周圍走咯。我知道有啲朋友咧就係佢因為冇人同佢攞藥咧，佢係周圍走嘅，但係其實唔需要嘅，因為咧第一嗰隻藥係可以寄嚟俾你嘅。可以用 FedEx 用郵寄俾你嘅快速郵寄。咁第二咧就係、是，就算 Uber 嗰啲咁嘅車咧，都可以同你去啲藥房攞咗，然後攞嚟俾你，然後同你即係你俾啲錢佢就得噶啦。咁所以係唔需要自己去攞嘅。甚至你真係要去藥房攞咧，你就留喺個車嗰度，咁然後咧嗰啲藥房嘅人咧係可以攞出嚟俾你嘅，係有呢個咁嘅服務嘅。咁所以咧就最好咧就係唔需要自己去攞啦，係咪？有親戚朋友可以幫你攞。
And this is just 3 places where you can look to see if the pharmacies have drug. So the first one is a pharmacy locator. So you can type in any city that you're in, and it can tell you which pharmacies in your area have Paxlovid or Molnupiravir. The National Test to Treat locations gives you the locations of all the places that you can do test to treat if you don't have access to a healthcare provider. And the last one is just places in San Francisco for test to treat locations. And if you need to get in touch with a physician right away, there are 24-hour online options where you can link to a provider online to assess whether or not you need drug. And this is important for people who have had symptoms for already up to 5 days. So if they're at the end of their eligibility window.
咁呢啲咧就係一啲網站咧，係可以幫你揾到喺邊啲地方有呢啲藥嘅。咁有一啲地方咧就叫做 test to treat， 就即係話咧你去嗰度做檢查，做個檢查睇下有冇呢個新冠肺炎。檢查到之後咧，嗰度即刻咧喺就係嗰個地方啊，就即刻可以俾藥嚟嘅。咁你唔需要又要再去揾醫生攞紙啊，然後又跟住去揾藥房攞藥啊咁，所以呢個咧係將個過程咧係簡化咗。咁到底呢啲地方喺邊度有咧？咁就係喺呢啲網站嗰度可以有咯。咁我咧就會將呢個嘅網站嗰啲地址咧，以前已經發布過噶啦。咁我就會喺下一次嘅電郵嗰度咧再發布多一次俾你哋。咁所以你而家就算抄唔到咧都唔緊要嘅。你睇我嘅 email 咧，下次嘅 email 啦，咁咧就會寫出嚟俾你哋噶啦。OK， 咁如果你係冇收我嘅 email 嘅咧，咁就你可以電郵俾我，我陣間會教你點樣做，然後咧就會將你參加咗落我嘅電郵網嗰度，等你可以收到呢啲咁嘅電郵嘅。
And a last slide on taking Paxlovid safely. So I mentioned that there are a lot of drug-drug interactions. So the main thing to remember about this is that as the patient, you know all of your drugs, but the pharmacy that you get your drug from may not have the complete list, and your doctor who prescribed the Paxlovid may not have the correct list either. They might not have all of the drugs. This happens especially if you have to go to different pharmacies to get to find Paxlovid. So it's really important for the patient to make sure they tell the prescriber what they're taking. And then it's really important for the prescriber to ask the patient. And then when the patient goes to the pharmacy, let the pharmacist know as well. So everybody is checking for drug interactions. It's everybody's responsibility, the patient, the pharmacist, and the prescriber. And this is really important because pharmacies may not have the complete list. They can't check for things that they don't know. So it's always very, very important to speak up.
咁咧，呢個食呢隻藥咧，因為呢隻藥係咁好啊，咁但係我哋唔想用佢錯，咁而且但係我哋又知道佢有咁多同藥同藥之間嘅互相作用咧，咁所以咧，你一定咧就係要將你自己食嘅藥咧係俾呢個藥房嘅藥劑師啦，或者開藥俾你嘅醫生咧，等佢知道嘅。咁因為開藥俾你嘅醫生未必係同你平時你個家庭醫生嚟噶嘛，咁佢亦都未必一定知道你嗰啲藥嘅，咁所以咧，你可能咧就係要自己將你嗰啲藥啊，所有食嘅藥咧，就寫喺張紙嗰度，咁你咧就可以帶嗰張紙，或者你將嗰啲藥抌晒喺個袋裏邊， 咁咧就帶嗰袋藥咧，就去個藥房嗰度攞藥嘅時候咧，就叫嗰啲藥劑師同你再 check 清楚啲，睇下呢啲藥咧係有冇係唔應該即係禁用嘅藥嚟嘅。咁依個咧，呢個責任咧係大家都要有份擔當嘅，係分開嚟，即係個病人啦、個藥劑師啦，同埋個醫生或者醫護人士寫個藥單嗰個啦，大家都應該負擔呢個責任，唔好第日開咗一啲藥俾一啲唔應該食嘅人食，就大家喺度互相指責。
And this is just one last slide on prevention. So tixagevimab, selgavimab, Diana, I'm going to wait to see how you say that in Chinese. This is a drug for pre-exposure prophylaxis. So this is a drug that you take before you get infected with COVID to prevent you from getting infected. It's not a substitute for vaccine, but it's really for patients who either are immune compromised, so you would not expect to have a good response to vaccine, or they have some type of allergic reaction to COVID vaccine, so they can't get it. And this is a nice option. So again, another tool to have in the toolkit on top of vaccination.
咁另外一隻藥，我哋正話講過嗰隻 Paxlovid 嗰隻藥咧，就係你感染咗之後你先用噶嘛。咁但係有啲人士咧，佢真係好高危嘅。佢點樣咧？佢第一佢就可能個免疫功能低啦。第二咧就係佢係就算係打咗針佢都即係個身體嘅免疫功能咧都發揮唔到出嚟嘅。同埋咧第三咧就係有啲人咧根本對嗰個疫苗咧係有呢個敏感嘅。咁所以咧，佢係唔可以打呢個疫苗嘅。咁所以咧，有呢啲咁嘅人士咧，我哋就要特別去保護呢啲咁嘅人士啦。就有一啲藥咧新出嘅，就叫做Infectious。我真係 ，so I'm not going to translate that into Cantonese because all these new drugs is really a challenge. So we are not supposed to do the translation in Canton in our language for them. The company, the drug company itself that manufacture the drug should come out with the standard translation, so everybody would be using the same word. You know what I mean? And so if they don't do that, then there is no translation. 咁呢啲咁嘅藥咧，佢呢個藥廠咧係冇中文啊。帶住用呢個藥嘅藥名咧，我哋係唔可以隨便將佢譯做乜嘢中文，好似輝瑞咁啫嘛。所以喺 Pfizer, they come up with their own Chinese name. We didn't make it for them, right? So 輝瑞嗰個藥名咧係佢自己公司出嚟噶嘛。咁所以咧藥名係唔可以亂咁同人改嘅嚇。So 咁但係呢隻藥咧，主要嚟講咧就係大家知道，如果你真係高危，你係免疫能個系統有問題嘅咧，係有一隻藥係可以幫你未感染之前。俾你服用，而你係可以減低你呢個感染嘅機率。This is an oral drug, is that right?
It's an injection. It's 2 injections into the arm.
So 呢個係打針嘅。So 2, not just one.
Well, it's one visit, but 2 injections at one visit.
Oh, why is that? I don't understand.
Because tixagevimab and selgavimab are 2 different drugs.
Oh, okay.
So it's 1 in each syringe into your butt.
Okay, so it's not combined into one thing.
No.
Okay.
No.
因為呢隻藥咧，佢其實係由2種藥夾埋嘅，所以咧係要打2針，就唔係話要分開嚟打，係可以一次打，因為佢係每一針都係一啲唔同嘅藥。一個咧就係 tixagevimab， 一個咧就係呢個 C 字頭呢個藥 ，OK， 咁咧就係但係夾埋呢兩隻藥咧就叫做 Infectious， 咁所以咧就唔係口服咯。
And this just shows you that it does work against BA4 and BA5. And again, these drugs were studied, this injectable drug was studied before we had Omicron, but we also know it works with Omicron. So this is just a nice option to have for patients who are immune compromised. And if you think you want to get this, is something you should talk to your doctor about.
咁咧，你知道咗有呢隻藥之後咧，如果你覺得你係可能呢隻藥對喺你嘅健康情況之下對你有幫助嘅咧，咁你可以同你嘅醫生講，睇下佢可唔可以同你寫單去俾你哋咯。咁咧，我哋知道咧，雖然呢隻藥做研究嘅時候咧，就嗰陣時未曾有呢個 Omicron 呢隻變種病毒嘅， 但係而家發覺咧，雖然研究嗰陣時冇，但係而家對呢個新嗰啲病毒咧，呢個 BA.4 同埋 BA.5 咧，同埋以前嗰個 BA.1 同埋 BA.1.1 咧，都有呢啲通通都係 Omicron 嗰啲變種嗰啲第二代變種啦嚇。咁咧就係發覺佢哋對佢都有呢個抵抗嘅作用嘅。咁就係淨係 BA.2 咧就好似冇。So we talk a lot so that we leave Dr. Chin Hong very little time to for his spiel.
I know Kathy did the hardest part, and now I can just, show my COVID doll and just give a lot of jokes.
No, actually, what Dr. Yang has done is to give us a basis to build on for your talk so that we can, based on what we know from what you told us just now, then look forward to the future. Right?
Yes, no, it was excellent.
Yes, thank you so much. So Dr. Peter Chin Hong, Professor Infectious Disease Division and Associate Dean for the regional UC campuses. And we are very fortunate to have him taking time out from his busy schedule to be with us today. 咁啊，多謝陳醫生係同我哋百忙之中抽空做呢個講座。This is a busy slide, Dr. Chin Hong.
Yeah, so what it's saying is that right now the world is getting a lot of threats simultaneously. It's not just COVID anymore, and probably a lot of these threats are stemming from all of the loneliness and all the disruptions we've had during COVID, leading to a lot of other social changes like hate, first of all, as we well know in the Asian American community, violence, but even beyond that, effects on the economy, recession, people's livelihoods, unrest in the world in general. One of the theories, for example, is that the Russian leadership acted in a certain way because they were they had a lot of mental issues that was brought on by the pandemic. No one could really know for sure, but many of these things are directly linked for these 2.5 years that we've had. So this is just a list of some of them. I think that this generation of kids would probably have a very different world because of, the legacy of the pandemic. But on the other hand, we've also learned a lot of good things from the pandemic too. So we're going to deal with that in the years to come.
呢個世界係非常非常之複雜，係充滿各種嘅挑戰，就唔淨止係呢個新冠肺炎。OK， 呢個新冠肺炎咧，我哋叫佢做地方病咧，其實可能係呢個大流行病都未過嘅，即係應該對呢個地方病呢個字咧，應該係仲未幾啱用嘅。但係除咗呢樣之外咧，我哋尤其是唐人嚟講啊，我哋有俾人蝦啦，俾人仇視啦，係咪啊？行出街係驚住俾人打啦，可能份工又冇咗啦，心理啊，即係成日喺屋企嗰度驚住出街，咁啊覺得好寂寞啊，個精神嘅同埋心理咧好大壓力嘅。咁同時咧對呢個抗疫有抗疫疲勞咯，樣都話唔得咁樣，出去食嘢又唔得，出去飲茶又唔得，出去買餸又唔得，行街又唔得，咁樣都好似唔得，咁啊變咗係呢個對心理好大影響嘅。咁啊而且咁啊嗰啲為咗黑人嘅人權咧，又有暴動啦，有山火啦，有氣候變化啦，好多嘢都係非常非常之麻煩嘅。咁啊，尤其是喺個社會上啊，真係唔係話病咁簡單嘅。你衣食住行啊，樣嘢都有問題嘅。OK， 住你屋企嗰度可能係住得好逼啦。OK， 行你交通上面。喺車嗰度都可以俾人打嘅喎，可以俾人開槍殺死嘅喎，琴日咁樣係咪？咁咧唐人嚟講，真係有好多仇視嘅事發生咯。咁你再加上咧呢個烏俄嘅戰爭，真係又係另外一盒眼淚啦。烏俄戰爭整到全球嘅汽油啊嗰啲個價格飛到上天咁高 ，OK， 咁然後咧就當然。佢哋亦都係死咗好多人啦。咁咧曾經有啲人咧就覺得話，咦會唔會係呢個戰爭嘅原因係因為由呢個新冠肺炎引起嘅？因為大家嗰個精神狀態啊係好低落啊，所以 即係引起呢啲咁嘅戰爭咁，咁啊冇人知道嘅。總之就係呢個世界就係非常非常之難咯。咁啊，我哋大人就話大人啦，但係喺細路仔嚟講，佢哋翻學又翻唔到，係咪？有一段時間翻唔到。尤其是係嗰啲窮嗰啲細蚊仔啦。如果係有錢嘅細蚊仔咧，嗰啲家庭咧，佢哋嗰啲細蚊仔去嗰啲學校咧就少人一班啲嘅。嗰啲細蚊仔咧可能翻到學嘅喎。咁呢個貧窮同埋富人嘅差距嘅問題咧，喺生活上面咧就係製造咗好多不平等嘅嘢出嚟俾我哋嘅。咁所以細路仔佢都會睇到㗎，睇到屋企裏邊可能好多嗌霎㗎，因為你啲大人喺晒屋企嗰度做嘢啊嘛，日咁樣對住，所以係好多好大嘅問題咯。咁我哋而家OK 經過咗呢2年半呢啲咁嘅日子啦，佢大人同細蚊仔都係一個非常之困難嘅日子。而家細蚊仔開始可以打針啦，咁到底我哋嘅生活係咪可以平常化啲咧？
Yeah, so where do we go into the future? Nobody really knows what will happen in terms of mutations. But right now, what we have is 5 flavors of Omicron: BA1, January; BA2, the beginning of March, April; relative of BA2, BA2.12.1, which is mainly US. And then in the wings, we have BA4 and BA5. So what it means is that with every new generation, they're getting more and more transmissible. And it means that people are getting more and more, not just infections, but reinfections. So with BA4 and BA5 in South Africa, even though 90% of people had seen infection before, it led to a surge. And in Portugal, the same thing in many parts of Europe. In the US, BA4 and BA5 is increasing faster than any other variant. It's already in the wastewater in the Bay Area and in Southern California. We've had a few cases, but nobody really knows if it's going to take over the landscape. The main issue is that even though the guards inside, the T cells and B cells, will keep you away from the hospital, because the spike protein looks so different with the new mutations, the antibodies in the front gate can't recognize it so well, so people can get infection and reinfection. But you're going to stay away from the hospital, like what Dr. Yang said, because of the vaccines. In the fall and in the winter, the Biden administration thinks 100 million more people might get infected. So that's a lot of reinfections, mainly because the immunity is going to decline and we may get new variants. So that's really why we should all protect ourselves from serious disease. Now, including kids under 5, because we don't know if the next variant will be more dangerous for kids. And you need some time for the immune system to get prepared.
呢個係個病毒咧。由佢開始到而家咧，呢2年幾咧，佢係不停咁樣變種嘅。OK， 咁由 Alpha、Beta、Gamma、Delta 咁一路咁樣轉到 Omicron 係咪？咁然後咧 Omicron 咧出咗嚟之後咧，佢又分第2代去變啦喎。由 Omicron Omicron 點1點2點2.2.21點1，然後跟住點4點5咁，一路都不停咁樣變落去嘅，跟住嗰個係邊個咧？唔知道。但係而家我哋知道咧，當佢變咗做 Omicron 嘅時候咧，佢已經係有成30個不同嘅突變啊。OK，Delta 嘅時候有大概10個嘅突變啦，係講個蛋白嗰個刺針嗰個位置嗰度。咁但係到而家咧，到呢個 B4、B5 咧，就有成50個突變嘅。咁呢啲咁嘅突變咧，就令到呢啲咁嘅病毒啊，係入咗我哋身體之後啊，係我哋嘅身體嗰個免疫系統咧，就算係打咗針，就算係以前病過、有過呢個抗體，都認唔到佢哋啊。佢哋將佢哋好似戴咗個面膜咁樣樣，係佢嗰啲抗體認唔到佢哋，所以對感染嚟講冇作用咯，係預防唔到感染咯。咁將來會點咧？將來就會點唔知道，因為可能再嚟嗰啲病毒咧，就可能唔係好似而家呢個 Omicron 咁。而家 Omicron 咧，其實佢係感染多咧，但係佢個即係令到我哋病得好嚴重嗰個情況咧，係唔係好犀利嘅。 即係溫和咗嘅嗰個病毒。但係將來嘅係咪有咁溫和咧？我哋唔知道。OK， 咁咧就所以而家整到我哋咧感染完又再感染，因為我哋感染完嗰啲抗體喺個身體嗰度咧係冇用嘅，打咗針嗰啲抗體出咗嚟嘅抗體亦都係冇用嘅，所以打咗針又冇用，感染咗又冇用，即係唔係完全冇用啦，但係個作用係非常之細咯。咁所以咧喺呢方面咧，而家我哋只係好彩就係因為佢呢個病毒咧就係好溫和，係唔係話整到好多人好大病，所以咧而家咧就唔係話有咁多人要入醫院，好多人會死，唔係咁。但係將來會點咧？將來係唔知嘅。OK， 我哋就唯有拭目以待啦。咁而家呢啲喺下邊一張圖片咧，你要睇到嘅，我哋轉去下邊嗰度圖片嗰度睇一睇。So, Dr. Chun-Hang, these are the genomic surveillance.
Yeah, so right now, most of the cases in the United States are a flavor of BA2, which is BA2.12.1. It's more than 60% of cases, including California. But the interesting thing is that BA4 and BA5, even though it looks like it's not a small percentage, the rate of increase is much faster. So you see in April, BA4 and BA5, very, very small, but look, between April and June, it's really, really increasing very rapidly, faster than other variants. So many people think it's going to be the main variant that will win. We don't know for sure, but if it wins, that means that a lot of people are going to get reinfected. But again, we are not going to go to the hospital. It's just that the reinfections right now may cause a lot of more disruptions in the community because people have to isolate and all these kinds of things.
咁而家我哋睇到咧，即係呢啲變種病毒咧，喺我哋感染嘅人之中嗰個份量啊。咁初嘅時候，年頭嘅時候，呢個係3月12號啦，2022年啦，就主要嚟講咧就係用呢個就係呢個 BA1 嘅 ，OK。咁然後咧呢個 BA2 咧就已經開始咗噶啦，但係咧一路咧你睇住 BA1 咧一路俾呢個 BA2 咧就佔咗路頭，一路咁樣直情將佢逼走咗嘅。所以到4月嘅時候咧 ，BA1 咧已經係冇乜噶啦 ，OK， 就差唔多大部分咧都係 BA2 呢個第2代嘅變種。咁咧就跟住隨住 BA2 嘅出現咧，就跟住橙色呢個咧，橙色呢個係咩啊？呢個 BA2.1、2.1。咁我睇到呢個見到你睇到嗰啲病毒咧，佢係一路一個冚一個咁嘅，即係一個嘅傳染率啊係高過另外一個，所以咧佢可以將佢冚過咗嘅。咁咧就一路咧就由呢個 BA2.1、2.1咧，呢個又係另外一個第2代嘅變種啦，就係呢個 Omicron 嘅變種啦嚇。咁咧佢而家咧就已經到咗呢個時候咧，就差唔多係喺美國裏邊咧。係大部分啊，60-70%嘅人咧，感染嘅人啊，都係呢種咁嘅病毒嘅。香港都係啦，都係好多係呢個咁嘅病毒，因為佢傳播得好快，你係可以講係難以抵抗嘅。OK， 就係琴日啫嘛，先至話連我哋嘅市長都有咗呢個都感染咗嘅。OK， 咁而家其實咧，我哋睇住綠色呢度。綠色呢個咧，一個咧就 BA4， 一個就 BA5，OK。咁而家咧，佢咧嘅升嘅速度啊，係升得非常之快嘅。所以陳醫生嘅推斷咧就係話，應該係好快啊，到秋天嘅時候咧，佢應該係喺美國嗰度咧已經係大行其道，就好似呢個橙色咁樣，係佔據咗大部分人嘅感染嘅 rate 嚟嘅。咁所以咧，我哋而家咧就睇到係咁嘅情形。所以啲病毒一路咁樣變，我哋咪要跟住佢去行咯。因為睇下佢嘅症狀係咩。如果佢係令到我哋病得好犀利嘅，我哋要用一啲方法；如果佢係病得好少嘅，我哋又要用另一個方法去應付佢。所以呢個世界咧，而家係可以講係啲人今日唔知聽日事嘅。
San Francisco, I must say, is one of the highest in the state right now for number of new cases. The Bay Area is number 1. Southern California is number 2 in terms of number of new cases. So even though we're not continuing to go up, we're still kind of staying at a very high level, and but not as high as in January, first of all. And then secondly, although we are probably seeing just an underestimate of the true amount of cases, because maybe 2 or 3 times more people are testing at home. But nevertheless, the curve is encouraging because it's like not continuing to go up. At the same time, hospitalizations are very stable, which is good news, has been stable for a long time, and not like the other surges. So it's really speaking to the power of vaccines, particularly in seniors and boosters. And if you look at what happened in Hong Kong, it's very different because same Omicron caused a lot of deaths in Hong Kong because of not enough vaccinations in the older population. But in the Bay Area, we've been doing pretty well. Same Omicron, but not as many people dying and not as many people going to the hospital, really driven by vaccinations, particularly in the older individuals. And the first booster, like Dr. Yang said. Right now in the United States, more people are dying who are vaccinated, even though most people are unvaccinated. But the people who are vaccinated are older and didn't get any booster. So that's why it's really important right now to get at least one booster.
咁我哋講嚟講去咧，就係呢個疫苗咧，喺呢個病情之中咧，一路咧都係佔住首位嘅關注嘅，係非常非常之重要嘅一樣嘢。如果你哋真係有咩親戚朋友係未中疫苗嘅咧，尤其是喺呢個咁猖狂嘅病毒傳染期啊，係應該叫佢哋快啲去中咯。即係香港點解咁多人死咧？就係因為佢哋好多老人家咧都係好遲先開始去中呢個疫苗，咁好多人都係可能打咗第一劑，甚至第二劑，但係嗰啲加強劑咧就係未嚟得切打嘅，因為你要隔咁多個月先可以打加強劑啊嘛。咁所以咧呢個打呢個疫苗咧，同埋要打足嗰啲加強劑咧，係一個非常之重要嘅環節嚟嘅。咁呢度其實咧就呢3個數字啊，我哋睇呢啲數字咧，大家都已經係2年幾都一路睇住啲咁嘅數字㗎啦，咁亦都相當熟啊。但係而家咧就有啲 Q 棘嘅，點解咧？因為呢啲數字真係唔係咁準嘅。點解咧？嗱，你譬如睇下呢個7日呢個平均7日嘅新個案啦 ，OK？ 呢個新個案以前咧就啲新個案咧，通通係由呢個打呢個 PCR test 嚟嘅，但係而家我哋做嗰個快速測試啦嘛，做嗰個antigen 嗰個抗體嗰個測試啦嘛。咁咧就係但係因為做嗰個測試咧喺屋企做㗎嘛，咁我哋亦都冇一個系統話，你如果係陽性嘅，你就要上呢個網站去登記，要報告俾我哋聽，等我哋加埋啲數據去。我哋冇啊嘛，我哋冇呢個系統啊嘛，香港就有，我哋就冇嘅。咁所以咧，到我哋而家睇見呢個429個數字咧，你隨時啊係可以加佢2、3、4倍啊感染嘅人數啊，係因為係喺屋企嗰度做呢個快速測試，所以你係冇真正嘅數據嘅 ，OK？ 咁至於呢個醫院嘅數字咧，呢個90咧，就可能比較準啲啦，因為你最低限度喺醫院就喺醫院，就唔係喺屋企啊嘛。但係咧喺醫院咧就有呢個問題啦，就係話咧你住喺醫院，但係有呢個新冠病毒咧，你可能唔係因為呢個新冠病毒入去醫院，而且係你可能係入去做咩手術啊，或者有其他咩病啊要入醫院。咁啊喺個期間咧就譬如，咦唔係喎，乜你嗰個新冠病毒陽性嘅咁？但係佢唔係因為呢個新冠肺炎而入醫院嘅，咁係有個分別嘅。因為你可能如果冇其他嘅問題嘅時候咧，唔係去做手術去諸如此類咧，你可能係唔需要入醫院。呢個係唔係住院嘅人數，所以呢個咧就係可能係會比真正嘅人數係高咗出嚟嘅。所以你睇呢啲數字嘅時候咧，你一定要明白呢啲數字係點樣嚟、點樣去，而你要去點樣去適應佢。咁樣先至明白個次嘅咩嘅嗱，咁呢3樣嘢喺度咧係咩嚟咧？其實呢3樣嘢咧就係而家美國就將每一個地區將佢分開3種啊，低、中、高度感染嘅方法嚟嘅，同埋咧呢個低、中、高度嘅分法咧，就係會令到嗰個地區咧會出咩政策，使唔使室內戴口罩啊，翻唔翻學啊，係咪要喺屋企佢遠距做工啊，抑或係要翻工啊咁，就係做呢啲咁嘅政策咧，就跟住呢個係你係高度感染、中度感染、高度感染嘅情況，咁就係睇呢三個 number 啦。一個咧就係到底有幾多個新 case，OK？第二個咧就係住院人數有幾多，第三個咧就係話咁你住院人數嘅比例啊，係個醫院嘅空位嘅床數嘅比例幾多啊咁樣樣。咁所以咧，如果你嗰個 嗰個比例咧，如果係高嘅咧，咁就當然入咗高危嘅地方咧，咁就好多嘢咧都可能要冚翻低，就係話樣都叫你隔離啊，乜乜乜啊咁樣樣。咁呢個咧仲呢個 vaccination 呢個打疫苗呢個咧，我哋係盡量係希望佢係接近到100，當然係唔會100咧，有啲人唔打得針啊嘛，咁但係咧呢個84咧，亦都係實在差得太遠啦，即係有成10幾個%嘅人咧係仲未接種嘅，呢幾個10幾個%嘅人咧係慢慢升嘅，因為你去三藩市咁，淨係三藩市一個咁細嘅地方都有700幾萬人噶嘛，咁你700幾萬人有10幾個%未曾接種喎，咁即係有成100幾萬人係未曾接種嘅。咁呢個係即係可以係，如果有事嘅時候可以死好多人嘅。咁所以咧，各位要做咩嘢嘅時候咧，就係要學去睇下，要點樣知道自己本地嘅數據，而去做一啲決定係應該點樣做啦。譬如使唔使戴口罩啊，去唔去一個 party 啊，去唔去啲大型嘅活動啊咁樣樣，係要有啲即係根據去做咯。This is a kind of an interesting slide just to show that we really don't know the future. We don't know really how many people will stay uninfected and have little infections, or how many people would be infected and have to go to the hospital and or get reinfected, and get sick, that type. So, but obviously the strategy is Dr. Chin-Hao, you probably can tell us how we can stay on one side of the screen and stay uninfected or have little symptoms, as versus fall on the other side where we have to be hospitalized or get reinfected.
Yeah, so right now we have a lot of the tools to keep us on the left side. We have Paxlovid, we have other medicines that can keep people away from the hospital, even if you get infected. And vaccinations is probably the best weapon against getting seriously ill, like Dr. Yang said. But some people may not be able to prevent reinfection, but I think if in the fall we get a better booster, like Dr. Yang said, the bivalent vaccine with an Omicron as well as another kind of variant, it may improve the vaccine to prevent even infection. So that may help with people staying on the left side even from infection. So that's what we're trying to do for the future. So, I think we will get there, but we may not get there immediately.
咁呢個將來嘅策略咧，就係盡量喺左邊嗰度啦，就係盡量喺左邊嗰度，一係咧就唔好感染，一係咧就感染咗咧都係個症狀好輕微，咁咧就係避免去右邊嗰度，就係要入醫院啊，同埋感染完又再次感染啊咁樣樣，因為你每次感染咧就會個情況可能係比較嚴重啲咯。咁呢個咁嘅情形咧，就係最主要嘅關鍵咧就係個疫苗啦。講嚟講去，大家可能喺嗰啲社交網站啊咁睇啲人咧猛叫你話打都冇用㗎啦，打都一樣感染啊咁樣，但係唔係嘅。你就算如果你打咗疫苗咧，佢係可以幫你係留喺左邊呢度 ，OK 係冇感染同埋係輕微症狀嘅感染，而唔去到右邊嗰度嘅。咁所以呢個打疫苗呢個係一個非常之大嘅關鍵嚟嘅。咁同時我哋都有藥啦，即係可以有 Paxlovid 呢啲咁嘅藥係可以撳住你，就算感染咗啊，嗰個症狀都可以係變得輕微啲，唔使入醫院咯。咁所以呢個咧就係我哋嘅策略，就係要盡量留喺左邊嗰度，唔好去右邊嗰度。The future is filled with uncertainties. That's what we're living with daily, right?
Yes, I mean, I think a lot of people have questions about long COVID or chronic symptoms from COVID, but it's normal to not feel well immediately after you've gotten infected. And remember, the definition of long COVID starts 2 months after your infection. So if you're still not feeling right, or you have a cough and it's weeks after the infection, it's still within normal. It's only after 2 months. So don't be panicked about it. But nevertheless, a lot of people, maybe 20 to 30% overall, do have symptoms that are chronic. It is more likely if you're more severely ill and if you have not been vaccinated. And probably more people will continue to get better within that year only a fraction of people go on to have symptoms after a year. But even if you think 1 to 2% of people have really, really bad symptoms, including brain fog that would last for more than a year, that's still 1 to 2 million people in the US because it's estimated about 100 million people got infected. So it's a lot of people and we need to understand it more.
咁呢個咧就係我哋係對將來係個情況會點咧？當然大家都係好多未知數喺度啦，係嘛？但係未知數之餘咧，我哋亦都係希望盡量咧就係唔會有感染或者係再一次感染完一次又一次咁樣去感染嘅。咁咧就係希望，因為呢啲感染咗嘅人同埋或者係再次感染嘅人咧，佢哋係可以有呢個長新冠呢個情況發生嘅。長新冠係咩咧？就係話嗰啲人咧感染咗之後咧，嗰個病徵啊，即係譬如你個人好攰啊，或者係周身骨痛啊、唔舒服啊嗰啲咁嘅病徵咧，係會流長過2個月嘅。如果過咗2個月都有嗰啲咁嘅病徵咧，就話你有長新冠呢個症狀噶啦。咁咧，咁啊呢啲人邊啲人會多啲有呢個長新冠呢個症狀咧？咁啊其實係我哋4月嘅時候個講座咧都講過啦，就係一啲如果你感染嘅時候咧，你感染得好犀利嘅，有嚴重嘅感染嘅，咁你有長新冠呢個症狀咧係會多啲嘅比率多啲嘅，或者你係冇打呢個疫苗，你亦都可能會有呢個長新冠嘅症狀係多啲嘅。咁咧大概而家嚟講咧，我哋知道咧就係喺美國嚟講，大概5個人之中咧感染咗嘅5個人之中咧，係有1個人咧係會有呢個長新冠嘅症狀嘅。咁你諗下美國嗰度有成咁多萬人、咁多百萬人啊，去曾經感染過嘅，哇！如果1/5嘅人有長新冠，你諗下呢個長新冠呢個情況係幾咁犀利咧？會，所以咧我哋係好希望係唔會大家嘅感染係會輕啲，係唔會有呢個長新冠咯。咁so this is just a recap of what we were talking about in April when we had the long COVID. So it's just a review that is a multi-system issue.
Yeah, so this slide is just saying from the acute infection, when you just get infected, particularly in people who are not vaccinated, you can get lots of body organs affected. But after the infection, which is the next slide, you can see in long COVID, some of the effects can last for a very, very long time. And then, like I said, many months up to more than a year in some people, and can have a big effect on people's life. That's the main point of these 2 slides as a review.
咁呢個咧就係呢個初感染咗新冠肺炎咧，係其實係唔係淨係個肺嘅，其他嘅症狀嘅器官咧都可能會受到感染嘅。即係個人覺得好攰啦，個心啦、肺啦、腸胃啦 ，OK， 即係不同嘅器官咯。咁咧耐咗之後咧，咁呢個長新冠咧都跟住係喺嗰啲咁嘅部位咧，亦都有嗰啲咁嘅症狀連續嘅。我哋成日見到咧就聽到話 brain fog 啦，即係成個人咧即係唔似以前嘅，諗嘢又慢啲，做嘢又慢啲，又好容易攰啊，好容易攰。呢個咧係一個非常之明顯嘅症狀嚟嘅。你平時可以做好多嘢都唔攰嘅，但係你而家咧做啲咁多嘢咧就已經攰到要去瞓低㗎啦。咁咧個心跳又可能有啲問題啊，咁樣即係呢啲咧就係個長新冠嘅症狀咧，就係同你初嘅時候受感染嘅時候，你係越多呢啲咁嘅症狀咧，你嘅長新冠嘅症狀咧就越多嘅，同埋機率咧亦都係會多嘅。咁我哋睇到啦，就係即係你即係直情好似唔同咗個人咁嘅，認知又有障礙啦，氣又可能氣喘啦，個心跳又快啦 ，OK 咁咯。
So we focus on long COVID with all of these 200 symptoms, but even regular things that we know about, like heart disease and stroke, is increased after infection with COVID by as much as 3 to 8 times. So specifically heart attacks, stroke, even diabetes. So there are a lot of things we don't understand about when people get infected. So those are all things that will, impact not just COVID deaths or disease, but normal things that we think about, like heart disease, strokes, diabetes, may go up over time because so many people got infected.
So 喺呢個感染嘅期間咧，係 心臟病同埋中風嘅人數咧係增加咗幾倍嘅。咁所以咧，大家都要留意有冇呢啲咁嘅症狀啦，尤其是你係感染過嘅話嚇。但係咧，其實喺呢兩年幾嘅時候咧，好多人咧都增加咗體重嘅。咁你增加咗體重，增加咗呢啲咁嘅心臟病啊、血壓高啊、糖尿病嘅機率咯。所以係好多即係呢兩年幾係唔容易過。
So this is just an example of clinics that are going in operation in many parts of the country and in the world, because you need a lot of different specialties to understand all of these 200 symptoms that people may have. The NIH is also studying this with more than $1 billion, and UCSF is the site. So people can just go onto the website recovercovid.org to figure out how to enroll if they have chronic symptoms from COVID that last more than 2 months.
咁咧因為呢個長新冠啊係一個咁多嘅器官嘅問題啦，咁好多時咧就係不同嘅醫療機構啊、醫院咁咧，佢都製咗一個新嘅部門。呢個新嘅部門咧就叫做新冠肺炎嘅門診 ，OK， 就係專係去呢個長新冠嘅病嘅。咁咧就係綜合咗好多嘅專科喺埋一齊，有心啦、肺啦、腎啦、精神科啦，咁通通走埋一齊啦，中西醫啊咁一齊夾埋一齊啦，去幫呢啲病人去等佢快啲復原嘅。咁咧呢個國家嘅健康中心咧，亦都係撥咗一大筆錢啊，撥咗10億啊。撥咗10億嘅美金去俾不同嘅醫院咧去做研究，咁我哋 UCSF 咧亦都係其中一個研究嘅地點嚟嘅。咁咧，如果各位有興趣參加，如果係各位曾經有過肺炎，而到而家都仲係有呢個長新冠嘅症狀嘅話，咁你係可以去參加呢個咁嘅研究嘅。What's the website again?
Recovercovid.org. I'll put it in the website in the chat.
OK， 咁陳醫生咧就會將嗰個 website 咧擺喺個 chat 嗰度。咁各位如果係有興趣參加呢個研究嘅咧，佢哋呢啲醫生咧亦都係可以喺研究嘅期間咧係可以幫到你復原咯。
So this slide is just saying that there are different tools that we have at our disposal compared to a year ago when California first reopened. We have so many tools now. You just use that in your toolkit and you bring them out. And the more you use, the more protected you're going to be. But I think it's just a way that we can re-engage in society, go shopping, go to the movies, go on trips, but know that we have these things to protect us. And nobody's going to tell you anymore to use this or use a mask. In many cases, you're going to have to make that decision on your own. But probably the most important thing, if you can't think about all these things, is to getting that vaccine and getting at least one booster. After that, you can use these tests to help you, not just with COVID, but with other emerging infections, influenza, monkeypox, all of these kinds of things. You can help by protecting yourself against COVID.
呢啲咧就係我哋而家手上面有嘅預防工具。喺2年半之前啊，當呢個疫情開始嘅時候咧，我哋係冇嘅，我哋係估下嘅。但係到而家呢個時候咧，我哋係知道，確實咁樣知道咧，做呢啲嘢係可以幫助我哋預防感染嘅。OK， 咁當然最重要嘅咧就係打疫苗啦。講嚟講去，講到口水都乾埋，就係請你哋去打疫苗，打埋嗰個加強劑。OK， 咁咧就係以前咧就係話初冇啦，但係有嘅時候咧，咁啊政府出嚟講啦。要你依樣，要你嗰樣，要你唔準依樣，唔準嗰樣咁咧就啲人好憎厭嘅。OK， 到而家咧政府學精咗啦，就話咁你自己睇住嚟做啦。點樣睇住嚟做咧？你要睇住嚟做，你要睇數據咯。所以你係唔可以蒙查查咁樣生活嘅。你要知道你喺邊度住，你當地嘅感染率有幾高，係咪好犀利啊？又話係 OK 咧咁咧，由你知道呢個數據感染嘅數據嘅時候咧，你就去自己話。咁我要做啲咩嘢啊？我使唔使戴口罩啊？我使唔使喺室外嗰度先至可以聚集啊？可唔可以參加大型活動？呢啲係要你自己去做啦。而家咧嗰啲美國啊，非常之放鬆啊，歐洲都係啫，好多地方都放鬆晒啦。OK， 唔叫你做乜做乜。所以其實個危險度係增加咗嘅。而家你搭飛機咧，佢都唔使你有一個陰性嘅測檢先至可以上機。而家你中意上機就上機，唔需要證明乜嘢嘢。所以大家都係要即係自己睇住嚟做啦。
So this is a recap of what Dr. Yang talked about, which is focused on drugs or therapeutics that we can have. But again, the most important thing, which is at the center of the last slide and this slide, is vaccines. If you forget anything, I know there's been a high uptake of vaccines in the Asian American community, but not necessarily a high uptake of boosters. So I think we need to continue to get the boosters for sure, because just getting 2 is not enough. But if you do get infected and you have one of the risk factors for getting seriously ill that Dr. Yang talked about, older, diabetes, lung disease, heart disease, etc. Don't forget you can be eligible for getting Paxlovid to prevent getting seriously ill. But there are other options as well that we talked about. But if you don't remember everything, just remember vaccines for and boosting, especially boosting, and Paxlovid.
咁陳醫生咧就講得好簡單啦。如果你哋各位樣嘢都唔記得嘅咧，記住3樣嘢，就係打疫苗，打埋佢嗰個加強劑，同埋咧，如果係感染咗嘅時候咧，就醫隻藥 Paxlovid，OK？ 醫隻藥呢個字咧，大家請你記住，係非常之重要，寫低佢 ，OK？ 咁咧就係可以幫到大家係當我哋前進咧喺呢個世界咁亂嘅世界生活之中咧，記住呢3樣嘢咧，係等我哋將來嘅生活咧係比較容易過啲嘅。咁咧就係當然我哋就係講翻正話，就係可以預防嘅嘢。咁然後如果預防唔到啦，即係感染咗啦，我哋都有藥醫，就唔同話2年半之前冇藥醫啦，係咪？所以個情況係好咗嘅，所以大家係可以有啲樂觀。
We have to get ready as a community for a world of uncertainties, but we've made a lot of progress in the last 2.5 years. So I don't want people to feel discouraged, because the only reason why we are doing so well now from serious disease is because we made a lot of efforts as a community to get vaccinated, to protect ourselves. And the San Francisco and the Bay Area has one of the lowest rates of deaths in the country and in the world because of that. Even though we have a lot of infections, in the world and in the country, we've had some of the lowest deaths per capita. So I think we've learned a lot from COVID. Part of it is we need to do a better job at protecting the public. But so much of that is dependent on politics. So, maybe having a public health group, like in some countries, particularly in Asia, where it's centralized when it's really important, but not centralized when it's less important. So I think in COVID, we learned that, all these different states were doing different things, and it doesn't make any sense if people can just move back and forth between states. But we need to have enough money in public health for that to work. We need that. We can't just focus on people when they get sick. Actually, it's better to prevent sickness by investing in public health. And public health has lost millions and millions of dollars in the last few years because people didn't think prevention was important, but it's much better than treating somebody who's ill in the hospital. We need to understand that there is differences in how disease occurs in different communities, like older Asians, older Chinese in San Francisco did worse in some senses than some other groups. And trying to understand that you can't use one technique for everyone is really important. I think we need to continue to be proactive about the future. There are a lot of new threats that weren't even mentioned, like avian flu, like other emerging infections that might threaten, what we know so far. And we are going to see more of these in our lifetime. I think we need to build trust with the medical profession and scientific profession. We're doing more and more of that. But it's so important to have a partnership between not just healthcare and the community, but the politicians, the healthcare and the community. I think in San Francisco, we did that really well, but not necessarily in the country. And so that's why we can only do so much as a community without that trust. And then messaging has been really important. I think that's why doing these town halls was so important during the pandemic, because we try to take the science and make it understandable by everyone and try to prioritize certain things, which is hard for everyone to do well. I think we understood that even if we can get better physically, that the mental health and the fatigue can last for a long time and impair how we re-engage with the world. I think at the end of the day, we have to be flexible. I think, being thankful for what we have achieved, being thankful of each other, gratitude is always a good way to deal with that uncertainty. And, for me personally, I always think about the silver linings of what we've achieved. Even though we've lost things, we've also gained a lot. So, we'll be in this together as we navigate this new world.
呢個真係我哋有咁多係唔肯定嘅嘢，呢個好模糊嘅未來世界，要做準備咧，實在都唔容易，亦都唔係一個人可以做嘅事。但係我哋係身為社會嘅一個分子啦，就應該最低限度做翻我哋自己本身嘅嘢。其他嘅嘢咧，就可能係政府啊、撥款啊、即係成個架構去做改造。因為肯定嚟講咧，就係我哋當呢個疫情嚟到嘅時候咧，我哋係直情係冇一個預備好嘅計策嚟到應對嘅。咁如果假如間再有新嘅疫情嚟到嘅時候，咁我哋點樣做咧？我哋係咪又係再咁束手無策咧？咁所以咧，而家呢個時候咧，就真係大家都要不同嘅用不同嘅方法去睇呢個世界，就係政府可以做啲咩嘢咧？喺聯邦嗰度撥款對呢個公共衛生嘅體制啊，佢哋之前大部分嘅錢咧都係俾晒嗰啲去醫病嗰啲人。咁但係對於防衛疾病保衛呢個公共衛生嘅嗰個方面咧，係非常非常之少嘅撥款嘅。就幾年之前啫嘛，就係將呢個疾控中心嘅撥款咧，就係將佢 cut 咗好多嘅。咁所以到真正有啲疫情嚟到嘅時候，呢個疾控中心咧根本係應付不了啊，都唔夠人手喺裏邊做應該做嘅嘢。OK， 咁所以咧呢個咁嘅情況咧係唔可以再繼續嘅，係應該要做改革噶啦。OK， 資源方面嘅分配，個體制裏邊要有啲咩人手喺度，係預備定將來假如有一日再係有依類咁嘅疫情啊嚟到打擊我哋嘅時候，我哋係可以有方法去應對嘅。OK， 唔會話束手無策咁樣，直情係失晒魂嘅嗰個成個國家。咁咧而家咧就係話人民咧呢方面係有問題嘅，因為我哋咧就對個醫療系統失咗信心，所以咧就有好多假嘅資料出咗嚟。咁當然呢個疫情咧令到我哋好多人嘅精神健康啊、心態啊，同埋呢個即係呢個返工啊諸如此類咧，係有好大嘅影響啦。咁呢啲方面咧，我哋亦都係要有一個應對嘅方法做好咗，再有出現嘅時候，我哋可以去應付呢啲咁嘅危機咯。最後咧就係話呢個不確定嘅因素咧，永遠都會係噶啦。我哋幾時都今日唔知聽日事嘅，係咪？咁但係我哋都係用一個感恩嘅心態嚟到生活咯。咁如果我哋有個感恩嘅心態，大家一齊合作嘅話，咁呢個世界係會變得好啲嘅。
We'll close with 2 slides about things that everyone should get ready for the future. And I think probably the most important thing is really to get vaccinated and boosted for everybody in the family, including kids 6 months and older, and especially for the older individuals to get boosters. But everyone should get at least a booster except those under 5, because we don't have that data yet. That's probably the most important thing. And then these other things, I think, is a good checklist for everyone to think about. So having a phone number available, understanding how to access Paxlovid, I think, is probably the most important thing. Who's going to provide it for you? Who's going to write the prescription? Do you have any drug interactions? And where you're going to get it. We've all provided those resources for you today. That's probably the second most important thing. So vaccines and boosting, then the Paxlovid, including phone numbers and the pharmacies. Even if you travel, you'll know somebody can just call it in for you wherever you go in the country. Internationally, it's still a little bit hard right now. I think then you think about what's in your cupboard at home. You want to get things always stocked in case you get infected or your family members, like things to make you feel more comfortable for cough, for nasal congestion, for headaches and fevers. Make sure they're not expired. I think a lot of people have like a thermometer at home, and the pulse oximeter to measure oxygenation has been very cheap these days. You can go and get one. It's good not just for COVID, but for anything really. When you do a televisit with your clinician now, by having that information, you can give a lot of information, even blood pressure and the pulse oximeter, temperature to the telemedicine clinician. So I think those are all important things on this slide.
我咧呢個 slide 咧，其實咧就係喺我嗰個電郵嗰度啊，已經出過幾次㗎啦。因為咧呢個 slide 咧，同埋下邊嗰個咧，就係幫你啊。如果假如有一日真係唔好彩染到 COVID 嘅時候咧，唔使失魂落魄咁樣樣，好驚咁樣樣，唔知做乜嘢嘢。OK， 呢個咧如果你係預備咗去做，其實好多人都已經做咗其中好多部分㗎啦。如果你將佢整理好，擺喺個地方嘅時候咧，知道自己如果感染咗，將佢點樣做咧，咁你到感染嘅時候咧，就會容易好多咯。因為大部分而家嘅人咧感染咗咧，唔係話打電話去急症室入醫院，唔係咁嘅，你其實喺屋企嗰度居家隔離嘅 ，OK， 咁所以咧係可以講係你自己做自己嘅醫生去做啲嘢。咁咧下邊嗰個咧，咁啊依度依個啦，就係正話陳醫生話最緊要咧就係你打疫苗同埋知道點樣去攞呢個 Paxlovid 呢個藥啦。咁啊其他呢啲嘢咧，你已經係大部分嘅人屋企都有㗎啦 ，OK。So Dr. Chin Hong, I was telling them that these 10 things, I've been putting it in my emails for the last 2-3 times. So all they have to do is just go to it and really work at it and just get things ready, and so that
not just for COVID, but for lots of other things like influenza and colds and wildfires. I mean, the masks help against a lot of different things.
So 陳醫生話，即係你做嗰個預備呢個咁嘅表咧，其實係對其他嘅感染病咧都係有用嘅，咁即係大同小異咯。咁而家咧，我哋咧就睇一睇呢個問題啦。Is there a way that we don't get COVID, Dr. Chin, huh?
Yeah, I mean, I haven't gotten COVID yet. I mean, there's still ways to, I think from the US data, maybe 40% haven't gotten it yet, ever. And then remember, there's an increased chance of reinfection. So you can still try to prevent it. It's not that everybody's gotten it, and you don't try to be afraid of going out, but you just try to do your best you can, just like other infections too. So that's kind of where we are. I think when we hopefully get a better booster, your chance of getting COVID will drop even further, even in infection. But right now I'm happy because with a booster, you're not going to get very ill.
You are more optimistic than Dr. Anthony Fauci, who got infected on Wednesday.
Yeah, but he wasn't very ill.
No, that's true. And then our mayor got infected and she wasn't very ill either.
No, and Kamala Harris got infected, but she wasn't very ill either.
Dr. Chin Hong 咧就陳醫生咧就係話其實而家喺美國咧有40%嘅人咧係冇被感染嘅，咁亦都希望係唔會再有更多嘅人受感染啦，因為我哋就嚟又會有多啲新嘅疫苗啊，有即係可能係可以減低感染率啊，同埋呢個好多人咧感染咗咧之後又再感染，未必係一啲新嘅未曾感染過嘅人有感染，咁所以大家都係留意住，盡量做自己最好嘅嘢啦。如果係有懷疑嘅話，就自己去小心啲咯。即係正話俾你睇嗰啲slide 上面好多方法咧，都係教你可以唔使受感染嘅。最重要，記唔記得係邊樣嘢啊？就係打疫苗同埋打加強劑。OK， 你未做嘅快啲去做啦。 second question, if a child is close to 5 years old, but not quite, should we wait for the child to turn 5 to get the bigger dose of vaccine, Dr. Yang?
So this was a question that was also in the chat. So remember, if you're close to 5, you can still get Pfizer, right? So Pfizer, you can still do that. And these vaccine doses are based on age. So even if you start at the lower dose, if your second dose and you're already 5, you would get the larger dose. So in a way, it doesn't matter. In my opinion, you should get what is available as soon as you can get it. And then we adjust as we go.
So 兩位醫生咧都認同係話你唔好等啊，而家有得打你就去打下先。咁打咗第一針先咯，因為兩隻藥都要打第二、第三針噶嘛，即係一隻打2針，一隻打3針咁嘛。咁如果你係差唔多到5歲，咁你打第二針嘅時候咪要打一啲大啲嘅劑量咯。即係到咗5歲嘅時候，你可以打5歲嗰種針啦嘛，嗰個劑量就會大啲，係咪？So if we think we have long COVID, but our family doctor does not think so, is there anything we can still do?
Yes, you can go to that website and contact the people and see if you're eligible for a trial. And it's not even a trial, it's just a group of people they're following. And those are experts, actually. They've seen more long COVID than anybody else in the area. So they will be able to give a better, more expert view. It'll be for free because they're evaluating you for the study. So it's probably the best place to go right now.
咁如果你嘅醫生個家庭醫生認為唔係嘅，你唔係長新冠嘅，可能就係即係唔好彩有啲咁嘅症狀嘅啫。咁你如果係覺得咁樣唔啱你嘅意思嘅，咁你可以去上嗰啲網站嗰度，去呢啲長新冠嘅專科嘅診所去睇咯。I should just ask you where you're going for traveling this summer.
Oh yeah, so I looked it up. So some of the best places right now, it changes all the time, are actually a lot of Southeast Asia is not doing too badly. Philippines, Indonesia, India, because they were hit so hard before. I think some of South America is not doing too badly. Central America, not too bad. Mexico, Costa Rica, and then the Northern Caribbean is not doing too bad right now. Puerto Rico is going down, Jamaica, all these other islands, St. Lucia, they're not doing badly at all. Of course, things are changing. I guess it's easier probably to say what's not doing well. Of course, the United States is variable, but the south of the US is going up right now, not a good place. California, Hawaii, actually stable. So if you're in California and you go to Hawaii, it's like the same thing. So except it's probably warmer. So I think, you use the same protection there. Europe is not doing well right now. And China, you'll have to quarantine for a long time, but they don't have a lot of COVID there. Taiwan has a lot because they have reopened Taiwan, and Australia and New Zealand has a lot too, but because they were trying to keep it closed and now they reopened. So there's a lot of infections there. Hong Kong actually is doing pretty well right now.
你哋如果係想去旅行咧，我哋而家講俾你聽冇用，除非你而家去咯。咁你就最好去旅行嘅時候咧，就睇下邊度嘅疫情係高嘅，你就唔好去嗰度，就揀一啲疫情低啲嘅去，咁你受到感染嘅機會就會減低啲，好嘛？咁而家暫時係歐洲啊嗰啲地方咧就係非常之高啊 ，OK？ 咁美國都有啲地方好高嘅，咁你唔好去嗰啲州咯，譬如南部嗰啲，咁而家係一路飆高緊嘅。咁但係喺南美啊好多國家啦，南美好多國家同埋菲律賓啊、印尼啊、印度啊嗰啲咁都係比較好啲嘅地方，係感染冇咁高嘅。咁並唔係話冇感染喎，但係有啲地方咧，因為佢係好似台灣嗰啲咁嘅地方咧，就係佢啱啱開放咗啊，咁咧就嗰個感染率非常之高嘅。咁即係大家睇住嚟做咯，睇下你幾時去，同埋當時嘅疫情係點樣樣。What's the last question? What's the newer version of Pfizer and Moderna vaccines targeting the Omicron variant? Is that more effective to cover us for the future new variants?
I don't think we know yet because a lot of these vaccines they're supposed to. So they're bivalent, so they cover more than one, the original plus something else. That's the hope. And there is data to suggest that does work. So the Moderna one, I think, is going to be ready to come out I think, in late August or early September. But we'll just have to see what is the Omicron variant at the time, by the time the vaccine comes out. I wish I had a magic ball.
But also, Kathy, you can talk about the combo booster and flu shot from Moderna. That's pretty cool. It's just one shot.
That's cool too. Yes. So the less shots, the better.
咁啊，可能因為冬天就嚟咧，秋冬就嚟，咁咧就有感冒嘅。咁而家可能嗰啲藥廠咧就已經開始係做一啲一針咧就可以蓋住感冒同埋呢個新冠嘅疫苗嘅劑咯。咁即係打一針唔使打兩針，咁係比較容易啲嘅。咁咧就係嗰個新嗰啲而家呢個輝瑞同埋呢個莫丹納咧。就係出一啲新嘅疫苗咧，就係針對呢個 Omicron 同埋另外一種嘅病毒嘅，咁所以咧，因為佢係可以針對兩種嘅不同嘅嗰個針刺嗰個蛋白咧，咁咧就係可能咧個效用啊係可以高啲，但係咧而家因為暫時都未知嘅，所以估下嘅。到時出咗嚟嘅時候就可能有數據可以話俾我哋聽。莫丹納呢個新嘅藥咧，可能到8月尾嘅時候就會出㗎啦。There's a lot of questions about the monkeypox, and I know that you've been busy working on the monkeypox, and so Dr. Chin Hong getting hit with this new infection right in the midst of COVID, as if we don't have enough infections going around. So what are we doing here with monkeypox?
So I would say that first of all, monkeypox we're not doing a great job of identifying all the cases because, it's hard. Some of these rashes are not very obvious, not like the pictures in the web from Africa. So people are missing them, and so it's being spread, and a lot of people getting it don't have contacts that were known. So it means that it's in the community, but it's not huge for the general population, and nobody's dying from it. So it's not like COVID. But it's something we would like to stop. So how do you stop it? By not being with somebody who's obviously sick. And if you see a weird rash, trying to encourage that person, either yourself or the other, to work it up to figure out what it is. And then what can we do for it if you have monkeypox? Most people get better on their own, but there is a vaccine that you can get even in early stages to prevent you from getting as a contact for you to get disease. That vaccine is a relative of smallpox vaccine. And then there's a pill that Dr. Yang is trying to get into UCSF. It's called TPOX. It's an oral and IV. That's for people with serious disease, if they get into the hospital, or if they have more extensive disease, or if you're immune compromised. And then there are other medicines we can use too. So I think that's kind of where we are at monkeypox. It's getting a lot of attention now because the cases are going up. California has 40 cases. New York started giving vaccines to anyone who wants it or thinks of themselves at risk. We're not there yet in California, but that's kind of where we are. And the WHO met today. They're going to release what their recommendations are tomorrow about if they're going to call this a global emergency.
而家呢個猴痘啊，喺美國嚟講咧，就係即係都係增加緊嘅。咁咧，加州而家咧就有大概有40宗嘅猴痘係發現咗嘅。咁猴痘嘅問題咧就係個症狀啊，就唔係話我哋如果你上網睇猴痘咧，係會見到一啲好突出啊、好容易睇到嘅症狀，但係實實在咧真實嘅情形咧就唔係咁嘅。嗰個皮膚嗰啲紅腫咧就唔係咁顯著啊，即係你初嘅時候未必知道嗰個係猴痘嚟嘅。咁但係好在咧，呢個猴痘咧暫時而家咧就唔係話好嚴重嘅症狀，佢即係佢唔會死人啦，最低限度係。咁就而且咧係可以有疫苗，我哋係可以用即係水痘嗰種疫苗啊，嗰個 smallpox 水痘嗰種疫苗咧係打落人嗰個身體嗰度咧，就可以防止呢個猴痘變得更加嚴重嘅。咁即係可以有啲方法啦，同埋有個嘅口服藥咧，叫做 T-pill 咧，都係可以俾一啲有感染咗嘅人士或者係症狀犀利嘅人士可以服用，即係唔係話咁束手無策嘅呢個症狀，因為佢係個情況咧係似水痘。可能係水痘嘅變種，即係啲咁嘅情形。但係而家嚟講咧，就係即係喺美國嚟講就 係上升嘅時期，但係咧就唔係話太多。喺非洲就多啲。So thank you again, and bring us to the closing here. And again, we thank Dr. Yang and Dr. Peter Chin Hong and our production team, Clifford, Sandy, and Raymond. Really, we have great physicians and great staff working at UCSF. We always work together and bring good programs to you. Hopefully you've enjoyed it, and we thank you for staying with us. And for those of you who do not receive the emails, please write me an email to ahi.ucsf.edu, and then just say add to listserv, and I'll try to add you in. Then you'll receive the email with all the things that we were talking about on the how to get ready for COVID if it hits you. And then we are also on Facebook and YouTube, and we have a website, ahi.ucsf.edu. Please go there. There's a lot of bilingual information, and that's helpful for other diseases too. So in the end, we're dealing with public health issues, and it requires the public to work together. And that's all of us, you, me, and the physicians and everybody else. So, and because of the uncertainties, we always have to stay vigilant and then do whatever we must to avoid getting infected. So we wish you well, and thank you so much for staying with us today. And thank you to Dr. Hong, Peter Chin Hong, and Dr. Yang again, and all of you. Bye-bye.